Welcome to another presentation by Dr. Nasir Abdullah, the Medical Director of Dean Hospital Ihsanlu. In this episode, we shall be discussing a very important topic. Sometimes it comes as a health condition of its own and other times as a symptom. It is a condition that every adult must have suffered from at least once in their lifetime. Listen attentively as we explore this important topic. Headaches. Headache is pain or discomfort that results from inflammation in pain-sensitive parts of the head and neck. According to the World Health Organization, almost half of all adults experience a headache at least once a year. And each day, about 16% of the world's population had headache. Headaches are a major cause of absenteeism from work and school. They also take a toll on social and family life. Headaches can be painful and sometimes annoying, but most of them are not dangerous and are easy to treat with a basic pain reliever. Headaches are broadly divided into two, primary and secondary. Primary headache means the headache itself is the main medical condition. It includes migraine, tension and cluster headaches. Secondary headaches are those due to underlying medical conditions such as sinus infection, injury, etc. Over 90% of headaches seen in primary care are primary headaches. Now let's discuss about the individual types of headache. 1. Tension headache. This typically present as a pressing, dull, pain that occurs around the forehead, the temples, and the back of the head, almost as if a tight band is squeezing the head. It results from muscle tension in the shoulders, neck, scalp, or jaw. It is estimated that over 70% of the world's population experience one at some point, making it the most common type of headache. They often start during teenage years. The pain of tension headache is usually mild to moderate but not severe. It often comes on without warning, and can last from a few hours to several days. It is most commonly caused by stress. Other causes are lack of sleep, depression, anxiety, alcohol use, skipping meals. 2. Migraine. This affects approximately 1 billion people worldwide. It can cause a moderate to severe throbbing or pulsing pain that typically occurs on one side of the head. It may last from 4 to 72 hours and typically worsen with activities. The pain and other symptoms can keep a person from doing their daily activities. It is more common among females than males. Some people experience migraine with auras such as seeing bright or flashing lights, smells, nausea, etc. Migraine is believed to have a genetic cause as it tends to run in families. However, it can be triggered by stress and anxiety, hormone changes in females, bright or flashing lights, tobacco use, caffeine and alcohol consumption, sleeping too much or too little, strong smells, certain foods, such as chocolate, matured cheeses, processed meats, etc. 3. Cluster headache. This involves recurrent, boring, burning, or piercing pain, typically behind or around one eye. Less common but occur more in men than women and typically start in the 20s. The pain tends to be severe and may last from 20 minutes to 2 hours. It usually occurs at night. Other symptoms that may occur with cluster headaches include watering or redness of the eye, drooping or swelling of the eyelid, reduced pupil size in one eye, facial sweating, a runny or blocked nose, restlessness. Now let's discuss secondary headaches. A secondary headache is a headache that stems from an underlying medical issue. It is a symptom of something else that is going on in the body. A wide range of conditions can cause a secondary headache. They pain ranges from mild to severe and can occur anywhere in the head or neck. If the trigger of secondary headache is ongoing, then the headache can become chronic. Treating the primary cause generally brings headache relief. Now let's discuss few examples of secondary headaches. There are several types of secondary headaches, but the more common ones include sinus headaches, hypertension headaches, hormone headaches, post-traumatic headaches, exertional headaches, rebound headaches. 1. Sinus headache. This results from inflammation of the sinuses, usually by allergic reaction or an infection. Sinuses are air-filled spaces inside your forehead, cheekbones, and behind the bridge of your nose. When the sinuses get inflamed, they swell, make more mucus, and the channels that drain them can get blocked. The buildup of pressure in your sinuses causes a deep and constant pain in those regions called sinus headache. The pain usually gets stronger when you move your head suddenly or strain. Other sinus symptoms may also be present, such as runny nose, cough, fullness in the ears, fever, colored mucus discharge from the nose, etc. To get rid of a sinus headache, you have to treat the underlying cause, which may necessitate you visit your doctor. But you can take the following steps to ease sinus pressure and pain at home. Apply a warm compress to painful areas of the face. Use a decongestant to reduce sinus swelling and allow mucus to drain. Try a saline nasal spray or drops to thin mucus. Use a vaporizer or inhale steam from a pan of boiled water. Warm, moist air may help relieve sinus congestion. 2. Hypertension headache. High blood pressure can cause a headache. This kind of headache signals an emergency because it usually occurs when the blood pressure becomes dangerously high. A hypertension headache will usually occur at back of the head, but sometimes on both sides of your head. It often has a pulsating quality and typically worse with any activity. If you suspect you may be having a hypertension headache, then you need to visit your doctor immediately. 3. Hormone headache. Women commonly experience headaches that are linked to hormonal fluctuations. Menstruation, using birth control pills, and pregnancy all affect estrogen levels, which can cause a headache. Those headaches associated specifically with the menstrual cycle are also known as menstrual migraine. These can occur right before, during, or right after your period, as well as during ovulation. 4. Post-traumatic headache. This is defined as the onset of persistent headaches within 7 days of experiencing altered consciousness due to a blow or impact to the head. It is the most frequently reported complaint following a traumatic brain injury. The symptoms of post-traumatic headaches vary widely, but most people experience symptoms similar to either migraine or tension headache. Additional symptoms can include dizziness or vertigo, insomnia, trouble concentrating or remembering, etc. Although post-traumatic headaches after mild traumatic brain injury usually resolves within weeks, chronic post-traumatic headache can be very challenging. And when persistent, it may significantly impact mental health and morale. Treatments for this condition involve everything from medications to lifestyle adjustments to biofeedback and relaxation techniques. Stress management, finding support from family, friends, and fellow chronic pain sufferers, or counseling can all help you cope. 5. Exertional headache. This is a type of headache that's triggered by some type of physical activity. This can be anything from a coughing fit to a strenuous workout. You might feel it come on during or after your workout. Exertional headaches is a pulsating pain on both sides of the head that may last from a few minutes to a couple of days. Exertional headaches can be either primary or secondary. Primary exertional headaches happen for unknown reasons. But experts think it could be related to the narrowing of your blood vessels that happens when you exercise. Secondary exertional headaches are similarly triggered by physical activity, but this response is due to an underlying condition. This underlying condition can range from a simple sinus infection to a tumor. Also, secondary exertional headaches usually come with other symptoms such as vomiting, congestion, neck stiffness, vision issues, etc. 6. Rebound headaches. This is otherwise known as medication overuse headaches. It results from someone taking headache-treating medications too often. 7. Thunderclap headache. This is an extremely painful headache that comes on suddenly, like a clap of thunder. It reaches its most intense pain within 1 minute and lasts at least 5 minutes. While some of these headaches are not dangerous, others are sign of very serious underlying conditions. Therefore, it is important to seek medical attention immediately to rule out life-threatening causes of a thunderclap headache. There are several other types of headaches, but let us stop here. The logical question that follows is, what should be done if you have headache? Most headaches respond well to over-the-counter drugs and rest, but when you notice any of the following, then book appointment with your doctor. You have 3 or more headaches per week. Your headaches keep getting worse and won't go away. You need to take a pain reliever every day or almost every day for your headaches. You need more than 3 doses of over-the-counter medications per week to relieve headache symptoms. Your headaches are triggered by exertion, coughing, bending, or strenuous activity. You noticed a recent change in your headache pattern. However, since headaches can sometimes be a symptom of a life-threatening condition, you should seek medical care immediately if your headache is associated with any of the following: confusion or slurred speech, fever, seizures or loss of consciousness, stiff neck, or pain in the ear or eye, weakness or numbness, headache after head injury, multiple headaches in children, severe headache that comes on suddenly or headache that doesn't go away. Your health care provider will take a detailed history, do a thorough physical and neurological examination, order for appropriate investigations, make diagnosis and draw up treatment plan. Note that it is important to diagnose headaches correctly so that specific therapy can be started to help you feel better. Treatment of headaches. Not every headache requires medication. A range of treatments is available. Depending on your headache type, frequency and cause, treatment options include rest, especially in a cool, dark room, warm or cold compress, stress management. This teaches you ways to cope with stressful situations such as using relaxation techniques. Biofeedback. This teaches you to recognize when tension is building in your body, how your body responds to stressful situations and ways to settle it down. Medications. Occasional tension headaches usually respond well to over-the-counter pain relievers such as paracetamol, aspirin, ibuprofen, etc. But be aware that using these medications too often can lead to a long-term daily headache. For frequent or severe headaches, your provider may recommend prescription headache medications such as triptans. For secondary headaches, drugs for the underlying cause will be prescribed such as high blood pressure drugs, antibiotics, etc. Drugs used to treat seizures and depression can sometimes be prescribed to prevent migraines. Taking care of yourself can help prevent most headaches. Here are tips to help you prevent most common headaches. Avoid headache triggers. Keep a headache diary to help you identify possible triggers for your headaches. Get enough sleep. Go to bed and wake up at the same time every day, even on weekends. Don't skip meals. Start your day with a healthy breakfast. Eat lunch and dinner at about the same time every day. Stay hydrated. Be sure to drink plenty of water or other fluids free from caffeine and sugar. Exercise regularly. Physical activity such as walking, swimming or cycling causes your body to release chemicals that block pain signals to your brain. Reduce stress. Get organized. Simplify your schedule, and plan ahead. Try to stay positive. Lose weight. Obesity can contribute to headache development, so if you need to lose weight, find a program that works for you. Quit smoking and limit alcohol. Thank you for watching. If this video benefit you, then give it a thumb up. Like, subscribe to my channel, and turn on the notification, so that you can be notified whenever I upload a new video.